And the idea is we take low-cost sensors, we mix it with the Internet of Things, and we create health dashboards. What you see there is an air quality sensor. It's actually running in that room there with live data going to the Internet. The other features, if we go on some of the features of the system, we can have dashboards. It's obviously health focused, but we can change any of the sensors. So at the moment it's an air quality sensor. You can have water. In the next iteration of the project, there is an e-health sensor made, which is about 100 quid, 400 quid for the kit. So then you could integrate that, and then you could have the messages going to GPs into any health system, anything you like. In theory, because it's a messaging system, you could take any of the other guys here, like the guys with the help me find me, and jump the messages into there. Within the system, there is dashboards. There is also a customised version of Android, so there is on here a version of Android built within the Hackathon. It has no Google Play. You would take apps off it. That would mean you could just have secure apps or dashboards for people around and about. We have flexible transport mechanisms, so we can back all the data, for example, from the sensors via Wi-Fi, via landline, via GPRS, anything you think. So, remote. It just sends it out. So this is how we started on Friday. This was Friday evening, 8 o'clock here on the left. Then by about 11 o'clock we had we finished all the soldering and we sort of got it running. And then by Saturday morning we had the Android operating system build, and then we started building the website that you see here. So in the future, as I've said, we will have support for the eHealth Shield, we will have enhanced dashboards, and we will have tablet support. So if I go to the dashboards, here is a live running dashboard. So Benedict, if you turn the light out for me, that darkness level, it's doing every 15 seconds, it's just gone dark. Turn it back on. For me, Benedict, please. It'll go back. Now, Benedict's kind of liked vaping, so Benedict is now going to go and start messing with the particulate sensor. So the light's gone out, and you should see that sensor in the air quality suddenly start to drop when he starts blowing on it. There we go. So Benedict's polluting our air nicely. So use cases, how we use it. Imagine this with a dashboard, 7-inch touchscreen on bus stations, polling round, showing you all the air quality around the island, polling around, showing you data from the water, polling around, showing you anything you want. So you can use it for public health, but you could also use it for nurses, care homes, anything you need to manage. The dashboards could be on-premise, so they could all be contained within one area, or you can, if you don't want to do the cloud, don't do the cloud. If you want to do the cloud, do the cloud. We can take data in, we can pump data out. The next iteration will have an MQTT broker, which will do 10,000 messages a second. We can scale them that way, that way. So in theory, the system is scalable as well. It's built on Amazon EC2, and that's really it. It's about giving people the information, managing your health horizon, health professionals using it. You could, for example, have people in that case where they're in hospital, but they need some monitoring, but they can't go home. So you could then give them this and monitor them at home, reducing hospital waiting times. You could monitor people in hospital, reducing less effort needed. It's a messaging system that can take any format, send it out, and it's running in real time every 15 seconds.